Hello everyone, welcome to Talking Health with Dr.Laz, your favorite health program on television. Reaching you as usual from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Right, today we are having episode 50 of this show and we've gone a long way. I really thank you, the production crew, Africa Independent Television, and everyone that has been supporting us all this while. We've done 50, we're still going to do additional 50 by the grace of God. And we keep going because health is everything and we must keep bringing you accurate information that you need to make the best possible decisions about your health. And also to the health administrators in Nigeria, all over Africa and around the world, we'll keep also giving them voices, as they keep doing their best and also holding them accountable as well. Today, we are going to be appraising COVID-19 pandemic response in Africa. And I'll be having two international journalists, award-winning investigative journalists, one from Nigeria, one from Zimbabwe. Both will be joining me via Zoom. And they are going to be doing, having to appraise the situation because these two journalists have been following, in Nigerian parlance, we say bumper to bumper, issues around COVID-19, human rights issues, accountability issues, and the response not just from Nigeria, but also Zimbabwe and other countries in the continent. So I'm going to be introducing my guests after this break. I know you can't wait to meet them. And just remember that you can still get us on our social media handles, Talk Health Nigeria TV on YouTube, and of course, they are displayed on your screen. And you keep watching the program as many times as you want, even after the live program on television. Do stay with us. We'll be right back shortly. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, like I told you, I have two award-winning investigative journalists, one from Zimbabwe and in Nigeria. From Zimbabwe, I have Hopewell Chin'ono. He's a documentary filmmaker, an international journalist of repute, a human rights crusader, and one that has followed closely the COVID-19 intervention, not just in Zimbabwe and the continent. You are welcome to the program, Hopewell Chin'ono, also known as Daddy Hope.
Thank you very much for having me.
All right, thank you very much. Also on the program with us today is Mr. Fisayo Soyombo. Fisayo Soyombo is well remembered in Nigeria and the rest of Africa as that journalist that spent 5 days in police cell and 8 days in prison while he was investigating, the corruption within the criminal justice system in Nigeria. He's also a journalist that spent some time at the Federal Neuropsychiatric Hospital in Lagos to also investigate the care that is being given to patients with mental illness. He's done so many other investigations around Ebola, military in Nigeria, cancer-related issues, and has won several awards as well. You're welcome to the program, Fisayo Soyombo.
Thank you, Laz, for having me.
All right, nice to have both of you. I don't see anybody that is more competent to talk about this program than you guys, given how you followed closely the COVID-19 interventions in your respective countries and also the continent. So I will start with Hopewell Chin'ono. I'll have him in the first segment, and then, the second segment, I'll speak more with you, Fisayo. Hopewell, glad to have you. According to media reports and also the conversation we've had, you have been at the forefront of pushing for accountability, respect for human rights, getting value for money, and also ensuring that the people of Zimbabwe, the COVID-19 response is not something that is mismanaged. Looking at it generally, let's start from your country, Zimbabwe. How is the current situation, especially with the directive by government that everybody must vaccinate and those who don't vaccinate have to resign their jobs? Can you appraise the COVID-19 response in Zimbabwe and of course the sub-Saharan Africa?
Thank you very much. I think that when COVID-19 emerged, the response by the Zimbabwean government was extremely terrible. And it was terrible because of two things. We had an incompetent health minister who was not qualified to be in that job, but he kept going on regardless of the medical community letting the president know that he had appointed someone who was not qualified and was incompetent. Secondly, the other problem that caused problems was the fact that the money that was set aside initially, 60 million US dollars, set aside for COVID response, to buy PPEs, to make sure that there is the testing kits, and to make sure that the health delivery system is equipped and ready to deal with this problem, was being stolen. It was being looted left, right, and center. I'm sure your viewers who follow Southern African politics would know that I was arrested and thrown into prison for exposing this looting of public funds. There was a huge uproar when I started exposing the looting of these funds, and for instance, for you to understand how bad it was, a mask that was being sold for 65 cents was bought by a criminal syndicate that was aligned to government officials right up to the top. They would buy a mask for 65 cents and then come and sell it to government for 28 US dollars. So the level of looting was so bad and rampant. There is a company which was part of this criminal syndicate, which is based in Namibia, run by a Zimbabwean doctor. It's a shelf company. It does not exist in reality. It bought things in China for $380, and they charged the Zimbabwean government for $67,500. So it's not that the Zimbabwean authorities did not know what was happening, but they were part of it. So, but as time went on, there was so much pressure which was put on the government to deliver. And I must say that the on the vaccination side, they've done as well as they could have, because I think we've crossed the 2 million mark now in terms of the first jab, and we crossed the 1 million mark in terms of fully vaccination, which I think is third best in Africa, which in itself tells you how terrible the situation has been in Africa, because the funds are there, but sometimes geopolitics takes precedence. For instance, Zimbabwe would not even accept free vaccines coming from the West because they wanted to buy their vaccines from the East, which is from China. In terms of delivery system, the health delivery system itself, it's in shambles. Doctors and nurses and other healthcare workers don't have what they are supposed to be having, but they're soldiering on. And I must really pay great respect to Zimbabwean healthcare workers, because they've really done well under very difficult circumstances.
Thank you very much for that information. Yes, you mentioned about your arrest. I'm aware you were arrested 3 times between July 2020 and January 2021 for reporting issues of corruption, human rights abuses. About the child you talked about, a child who overzealous security agents, led to an unfortunate death. There were also issues around health workers going on strike at some point, not just doctors, but nurses and other health workers. How well has those issues been handled? Of course, because of your reports, the Minister of Health was reportedly sacked sometime last year. Has the replacement improved on some of those observations you've made? And there's some progress that have been recorded in the recent past.
This is what happens in dictatorships. They persecute journalists and critics for exposing the truth, for exposing corruption. After I was arrested the first time, the situation in terms of COVID-19 was really bad. I was in prison for 45 days, as I said earlier, and all the prisoners around me did not have masks, which means, again, this is a direct consequence of the looting of public funds that were meant for COVID. It's a terrible situation. But in terms of vaccination, they've tried their best, as I've said earlier, and they've vaccinated, fully vaccinated over 1 million people, and partial vaccination, I think, is over 2 million people now, and is the third in Africa. We have used 2 vaccines, mainly Sinopharm from China and Sinovac from China as well. There's been usage of I think, negligent usage of Indian and Russian vaccines. We've been offered Western vaccines by the United States of America. They've been turned down because of geopolitics and because of the unnecessary antagonism between the 2 governments of America and Zimbabwe, because the Americans are demanding that Zimbabweans should respect the rule of law, they should respect their constitution. And because of that, Zimbabwe says, you can't tell us how to run the affairs of our country. So they have refused to take those vaccines, which is very unfortunate because they could have gone a long way in trying to address the COVID situation. We had a 3rd wave, which killed a lot of people. At one point, it was killing around 100 people a day.
It appears you can't quite tell me, but
of just about,
I think
we've less
you
than 30
really
million people in Zimbabwe
provided a
living in
lot of
Zimbabwe.
information we
Those
needed
numbers
in that.
were astronomical. But the 3rd wave is now being contained. And we're just worried that if there is a 4th wave, the health delivery system is not prepared. When the 3rd wave and the 2nd wave happened, the hospitals were packed. There were no beds for people. People were dying at home, which is very unfortunate. And the government of Zimbabwe rides on the fact that they are 3rd best in terms of vaccination, but they are 3rd out of the West, which is what I've always said, that if you are in a class of dull people and you come first, you can't congratulate yourself for that. And the African continent is failed because there are strategic issues and there are structural issues. The structural issues are that the leaders on the African continent have failed to invest in science. They've failed to invest in creating scientific institutions that could come up with a vaccine. There's no single African country that has developed a vaccine, and that's a tragedy. And then the second thing is that there's a structural issue of incompetence. African governments have failed to negotiate to get as many vaccines as are needed. I think the African population, compared to the rest of the world, we've vaccinated less than 4% of our population, and that is very terrible.
All right. Thank you very much, Mr. Hopewell Chin'ono. I think your response captured most of the questions I wanted to ask. I tried to stop you at some point, but I realized you could not hear me. But I really thank you for that appraisal in the situation in Zimbabwe and also the recommendation you've made to the African continent. I quite agree with you that we must be producing vaccines, local vaccine production within the continent, and of course, be more accountable and respecting human rights. So, Hopewell Chin'ono, thanks for joining the program. Okay.
Thank you very much for having me.
Right. We're going to take a break now, and when we return, I'll be speaking to Mr. Fisayo Soyombo to also get his perspectives on the COVID-19 response in Africa and how we can improve going forward. Do stay with us. We'll be right back shortly. Welcome back to Talking with DrLaz, your favorite health program on television. Yes, we are appraising the COVID-19 response in the African continent, and I have with me 2 international investigative journalists that have won several awards for their job, the fantastic work they've done in their respective countries, Nigeria and Zimbabwe, and also in the African continent. In this second segment, I'll be speaking with Fisayo Soyombo. Hello, Fisayo.
Thank you, Dr. Laz. I can hear you clearly. Good afternoon.
Okay, yeah, good to have you on the program. I believe you listened to Hopewell Chin'ono from Zimbabwe appraising the situation right there in Zimbabwe, and I'm sure you'll be feeling that it's not much different from the situation here in Nigeria. So in a couple of minutes, how would you describe or appraise the COVID-19 response in Nigeria?
Oh, the COVID-19 response in Nigeria turned out to be a reflection of the very issues that have dogged Nigeria as a country for decades. It was blighted by corruption, nepotism, what you call man no man, in Nigeria. There were lots of deaths that were quite simply avoidable, deaths that should never have happened if people lived responsibly, if people adhered strictly to the ethics of their profession, if people took public service seriously, if the government had the political will to give health workers the tools that they needed, and of course, if the people trusted their government, because a government that has continued to impoverish the people, successive governments that have impoverished the people cannot expect trust, and it showed the trust deficit the people had for the government affected the COVID-19, the management of the COVID-19 pandemic. I'll give you an example. One man in Kwara, educated, traveled out of the country, living in Lagos, traveled, saw that he possibly had signs of COVID, spoke to a doctor friend of his in Ilorin, got taken into the A&E, got treated by doctors, refused to divulge full information simply because he spoke to a professor. They didn't test him. He got infected. He died, and of course, his wife tested positive afterwards. And then a lot of fear, among the health workers who should have known that this man had been in the UK. Eventually, University of Ilorin Teaching Hospital, right, constituted a panel to investigate. Until today, we don't know what has happened.
Yes,
It's the
Fisayo,
same
I
in a
recall
state like
that.
Kogi, where the governor insists that there is nothing like COVID. In a state like Cross River, where the governor, through the back door, insists that nobody should get tested. The commissioner for health gets samples, delays testing, or refuses to test. Or in a place like Abuja, the seat of power, where even in the second wave of COVID in December, you had a testing center at the National Assembly that got to a point that it stopped collecting samples from the public. You had another testing center where, as of December, there were 7,000 samples that had been collected and had not been touched.
Okay,
So all
Fisayo,
the
let me.
problems that have affected us in the past, they
Yes.
came to the fore this time around. We were thoroughly exposed as a country where leaders do not think. Leaders
Okay. Are
do
there are
not
there
look at the
are there not
future.
some positives that
And
you've seen
the most
in this period, Fisayo?
unfortunate part of it is that COVID has happened and you can't see the response. You can't see the plan. You can't see the lesson that has been learned in saying we have to do better. If another pandemic were to strike in 10 years, we have to be better prepared. And that's what worries me. The fact that this has
Okay.
happened, lives have been lost, and we are not in a better position.
Yes, you've laid down a good number of things that have not gone right, but are there not some positives that you've observed in the process of following closely some of the things that have been happening since this pandemic came up?
Oh, of course, there are positives. There are positives. You find positives in the sense that we continue to rely on luck. That's what we've done in the wider scope of our life as a nation. You have individuals who come up who want the system to be better. People just decide to volunteer. Private sector coming together to collaborate. You had Kakovi, people pulling funds together, people donating their offices, their houses for COVID-19. So the most important positive I can point at is the will of the average Nigerian to not give up, to become an emergency government, to fill in for government, So yes, in that wise, you can say that there are positives. in the course of my coverage of the COVID-19 pandemic, when I used to run serious COVID-19 series, I did come across a number of doctors that I saw were patriotic, people who just wanted to work for this country, people deeply passionate about it, and that cannot be bad.
Okay.
So in that sense, there are positives. But again, if people come together and pull funds together and it is marred by corruption, the gains are lost. And the unfortunate, one other unfortunate thing about the COVID-19 pandemic is that the kind of corruption that went down can only be exposed for every hospital, for every state, for every setup. The corruption that went down can only be exposed by a few people, such that if it gets out, you already know the people who did it. So you had health workers who saw things that were happening, key people who saw the corruption and mismanagement and could not stop and could not leak it to the press, could not provide evidence to the press, because it was clear that if that information got out, there were probably just 1, 2, 3 people who could have done it.
Okay.
And that's what makes it really bad. People have no idea of the extent, the scale of corruption that went down during the pandemic, and it defeats. It defeats a lot of things.
Okay, that's fine. But there are some positives, some other positives within the system that perhaps you may not have quite observed. The setup of the Presidential Task Force on COVID-19 kind of provided a good national coordination platform, to lead that national response. And that has been commended in a lot of quarters. And also the testing laboratories, as at the time COVID-19 came to Nigeria, there were just about 2 or 3 laboratories that could conduct the test. But right now we have perhaps over 70 or over 100, both public and private laboratories that have the capacity to conduct PCR tests, not just for COVID-19, but also for Ebola, for Lassa fever, and other forms of viral diseases. And of course, at some point, WHO commended Nigeria for the level of political will that it demonstrated in terms of controlling COVID-19. But besides some of those positives and also the down points that you've mentioned, now looking at it from a holistic view in the African continent, there are some opportunities that COVID-19 presents. So what are your recommendations on how Nigeria and the African continent can key into gaining those positives that this pandemic have presented in terms of local vaccine production, in terms of so many other interventions that can be done?
But to just mention a point, if I were the WHO DG, I would at some point commend Nigeria, because you know that institutions like that are not in the business of confronting government. I'm an investigative journalist. I have no political leaning. I'm not looking to work for government. I can see things as they are. We have to demand more than the barest minimum from our government. And so if the government enables the creation of more labs, that's normal. That's what government is there for. That's why people pay tax. That's why I pay tax. I pay tax to government so that the government can be responsible in situations like this. But if you have the capacity to do 20, 30, 40 times more than what you are doing, then I'm not impressed. I'm not saying that there weren't people who did well, but as far as government, as an institution, as far as the political will is concerned, could have done a lot better than that. Of course.
Okay, what's the way forward?
How can we then consolidate? We can't make any progress without political will. As I said, there was a time in December 2020, second wave, we still hadn't mastered the process of testing. The lab, we still had, in December, there was a time 7,000 samples were still untested, and then they had to stop. And that's like, how long? A whole year of having to learn about how to deal with the pandemic. But moving forward, as always, for every of the problems in each sector of this country, we have to get the right people into government. Until that happens, we will continue to perform well beneath our capabilities. That is one. We have to look into the future. The government has to be interested in funding the health sector, funding research for the health sector, funding doctors, people like you, to properly sit down and tell us what the next pandemic is likely to be, what is likely to look like, when it is likely to be, the systems that are needed to be in place to make that happen. We have to look into the future and be prepared as a continent. We can't afford to sit down. We can't be proud of ourselves that all we can do is sit down and wait for the West to import vaccines into Africa. No, we have to do better than that. And we know that fairly every few decades, a pandemic comes along.
Okay.
And we have
Just conclude your thoughts.
We have to be ready for the next one.
All right. Thank you very much, Mr. Fisayo Soyombo, for sharing those thoughts on how we can improve our readiness and also be more accountable in COVID-19 control in the continent. All right. Thank you very much for joining us on the program today. There's a lot of thoughts around COVID-19, response, and just one show might not be enough to get all the perspectives. Our guests today from Zimbabwe and from Nigeria have, raised a number of issues bordering on issues around corruption, human rights abuses, and mismanagement. But we know that there's also a number of positives, both in Nigeria, Zimbabwe, and the rest of Africa. And for this program, we want to bring the issues and also make clear recommendations. So our guests have already stressed the need for us to consolidate, do local vaccine production, and also not just local vaccine, but personal protection equipment to create jobs and also improve the economy and minimize or, in fact, eradicate corruption in the entire process. So thank you very much for being with us on the program today. As we continue, we count on your support, and we also thank the production crew for the great job they've been doing in helping this program come to you. My name is Dr. Laz Eze. We'll see you next week, same station, same time. Bye for now.